So that's good to see. So yeah, we're discussing innovation for good. So what does it mean to keep good for society in mind when we're innovating? So I'd like to introduce Dr. Chenmao Davis, Liz Ashall-Payne. Perhaps I could ask you each to just give us a quick overview of your particular interests, what you do at the moment, and that will give us a bit of context. Can I start with you, Liz?
Yeah, of course. Thank you for having me with you today. So my name's Liz Ashall-Payne. I'm the founding chief exec at ORCA. ORCA actually stands for the Organisation for the Review of Care and Health Apps. And when I talk about apps, I'm not just talking about apps on the App Store, I'm talking about digital health technology at large. And although our name stands for what I've just described, actually our mission isn't to review and approve digital health technologies. Our mission is to improve lives through digital health. Now, the biggest barrier to adoption is trust, because unfortunately, although we have access to over 375,000 digital health technologies, our research has found that only 20% meet the quality standards that you would expect. And so we review and approve digital health technologies in a repeatable, proportionate process, and then we disseminate that information to people, patients and healthcare professionals so that they now know which technologies are best fit for their needs.
Excellent. Thank you very much for that introduction. So let's ask Chen to just introduce herself as well. You might remember earlier that Dame Wendy Hall said that we don't all speak Chinese, and she's right, but I'd like to say Huan Ying to Chen nonetheless.
Hi, well, thank you, and 谢谢 Brian. Speaking a little bit Chinese. So hi everyone, my name is Dr. Chenmao Davis. I'm the founder and CEO of Latch8. So I'm just going to tell a little bit about myself. So 18 years ago, I came to the UK from China with 2 suitcases, no personal network, and minimum English. And since then, I overcame extraordinary challenges and established a celebrated career in science and technology. I have conducted some world-class research in computer graphics and animation, developed cutting-edge technology for sustainability, architectural and product design. I have also fulfilled my lifetime dream of creating breathtaking visual effects for feature films, including Gravity and Blade Runner 2049, winning Oscar and BAFTA awards for best visual effects. But my life course has changed completely after I became a mother and experienced tremendous breastfeeding challenges. Struggling to achieve a good latch, I suffered from breast infections, baby's weight loss, and postpartum depression. Sadly, my experience is not uncommon. The UK has shockingly the worst breastfeeding rate in the world. 90% women give up breastfeeding before they want to because of physical, emotional pain, and poor support. And this costs global economy a staggering $1 billion per day and costs NHS at least £50 million per year. And driven by my personal struggles with breastfeeding, I set up Latch8 as a fintech startup using cutting-edge 3D interactive technology and empathetic AI to help mothers learn breastfeeding skills and access credible and personalized parenthood support 24/7. Founded by Innovate UK, EU and NHS, and co-developed with top infant feeding and maternal health experts, Latch8 app has already attracted active users from 20 countries across 6 continents. We are piloting the app with 12 NHS trusts and Virgin Care across the UK, and we are launching at Apple App Store this July. At Latch8, we believe all women deserve the support and empowerment to give their child the best start of life. So we really hope we'll become the global market leader and go-to breastfeeding and parenthood support app by 2023. Thank you.
Nice, thank you. Okay, so 2 different angles there, but we can see the crossover. We can see the societal benefit thing in both of you, which is why we've got you on the panel, obviously. So what I'd like to ask you first of all is when you were undergoing your journeys, did you come across this move fast to break things mentality? Now that's been quite widely reported as being an approach that certain IT entrepreneurs have taken, but it does tend to undermine the idea of being ethical. Liz, have you come across that? How did you handle that?
Really great question. And the thing that drove me to found Orca, my background is clinical, worked in the NHS for 20 years. And the thing that frustrated me was I could only see one patient at a time. And actually, with the rise of digital health technologies, I saw the opportunity to get digital health solutions to millions of people all at the same time. But what I also saw was the barriers to adoption. And as I mentioned, trust being the ultimate barrier. And as clinicians, we're trained not to trust things, not just to deploy solutions. And so I think because, I am a clinician, I have that ethical value base right at the core and center of everything I do. So I do appreciate that in other sectors, break things and work fast is maybe the approach to take. I think healthcare is different. We're talking about people's lives, we're talking about people's health, and therefore taking a little bit of time and probably quite a bit of time actually to make sure that what you're delivering is robust and credible and can be trusted is critical, because trust is quite a difficult thing to build, but it's a very easy thing to break. And so when we started our work at Orca, we spent really the first 2.5 years building strong foundations, opening ourselves up to interrogation, constructive criticism, making sure that what we were delivering was fit for purpose and robust and managed any risks in a careful way. And I think that stood us in really good stead. I think when you start to see products coming to market that have been, that haven't gone through a robust ethical process, you don't see the adoption happening really actually at all, irrelevant as to how long they're going. So take the time up front. It can feel painful, but it's absolutely critical in this sector.
Excellent, thank you. Chen, what's your experience there?
So I really echo what Liz has mentioned. I really admire what great work Orca is doing. And actually we are going through an Orca review very soon, and hopefully we can have a good score from this. But it's really, I really echo this part of kind of innovation adoption. So I have 2 points made. The first point is about innovation adoption. From my personal experience, there's very little innovation in supporting breastfeeding mothers or new mothers, and it's predominantly face-to-face. And this is almost paralyzed by COVID-19 pandemic, the kind of breastfeeding support sector, because after women give birth, they are discharged very, very early from the hospital. And once they get home, they have very, very, very little midwife and house visitors visits. They were left with phone numbers and leaflets, and millions of mothers are struggling at home with their breastfeeding issues, with a crying baby, and with a lot of emotional support needed. Actually, last year we've done a survey, UK-wide survey with 706 women. Most of them are lockdown mothers, about how COVID-19 has paralyzed, how COVID-19 has affected their breastfeeding experience. And 75% women said they felt isolated, and 81% felt they were not getting sufficient breastfeeding support because of social distancing measures. But when we are actually talking to our NHS partners or potential NHS trusts to partner with about our innovation, I think we can feel more fear rather than kind of welcome, because they're more worried about, are we going to replace them? We try to try very hard to explain to them that we are complementary. We're not trying to replace any existing support, but there is a big gap at the moment to support mothers sufficiently, and digital support is basically the future, and we need to try maybe hard to adopt this kind of digital support rather than being scared of it. But actually, from my experience, we have actually convinced a lot of forward-thinking trusts to work with us to pilot the app. Therefore, we actually have 12 trusts working with us from 4 large regions in the UK to actually give large apps to thousands of moms to use, to improve their experience. So that's a really welcoming thing, very welcoming kind of progress. Another point I want to make is through my experience of raising investment. So I find investors are very, very driven by profit margins, by user retention, by the customer lifetime value. So once they look at Lashe app, they think this is a breastfeeding app. And a lot of investors probably didn't understand this journey of the motherhood journey is a roller coaster journey. It's not something that you learn a skill and you quickly, it click for you and you don't have problems anymore. But investors think once breastfeeding mother use Latchet app for a few weeks, and then if they can solve their problem, they will leave. So why invest in Latchet? Because, you know, maybe they couldn't just make as much money or return from a startup like this. So I have been facing a very big challenge to try to explain to them, people will use Latchet for a long time because this is a long journey with lots of ups and downs, and women really need innovation and emphasis to support them. Secondly, I personally think if a society or if the innovation couldn't even solve a problem you can see so clearly, what's the point of looking at the profit margin? What's the point of looking at, you know, how much return you can get? All the innovation and all the kind of hard work should be driven by needs. And this is such an unmet needs at the moment to support mothers.
Interesting. Thank you very much. Now that leads us quite nicely on to ethical considerations about data usage or sustainability discussions. This was your experience in that area?
So, I mean, what we do in this regard is we assess compliance with data security, data privacy standards. Now, what we find is that quite a few innovations don't necessarily meet compliance. The real reason for that isn't because innovators didn't want to be compliant. The real reason is because they didn't know what they had to be compliant with. And when we look at things like data privacy and data security, it actually quite often depends on which jurisdiction you're working in, what you need to be compliant with and how you need to be compliant. So I think that our experience has been that there needs to be a big piece around education. You know, what we're hearing from Dr. Chen is, you know, as a mum experiencing a challenge, creating a product, why would you know about the world of regulations and standards? Equally, as a clinician, why would you know? These are people experiencing real world problems. So I think our experience is quite often products don't necessarily meet compliance, but what we need to do is have a system which encourages innovators to be compliant with a carrot rather than a stick. And I think that the other piece that's really important from a data perspective that's really high, particularly this week from a topical perspective, is interoperability. And what we're seeing is a real push towards interoperability, being able to share health data across the system. And what that means is we now need a whole raft of new standards around interoperability, consent, authentication. And again, these standards can't be being produced in isolation. We then need to educate the market so they know what good looks like, so they can ensure compliance.
Interesting. So Chen, you've got the perspective of someone that's been doing some innovating. Is your feeling that the innovation ecosystem kind of rides roughshod over some of these ethical considerations, or is it perhaps, as this was just saying there, that innovators don't always know where they should be going to make sure they are compliant?
This is a really good question. I think for Latchet, because we have been supported by some really great organizations such as Innovate UK, such as Cambridge Social Ventures, Unlimited, and many organizations that are very ethical and driven by social impact and social mission. So we were told from very early on about things we need to be compliant with, especially when we work with the NHS. We need to make sure we have a robust kind of data protection policy. We need to complete the DPIA kind of procedures. We need to make sure that we actually, inside our organization, we have very kind of clear policies of how we're going to moderate our user communities, because we understand for the new mothers, they are in a very vulnerable stage of their life. And we try to make sure our community is friendly and non-judgmental. And it is very, very important, because there are a lot of very popular website or online groups that have loads of discussions, but women can be very judgmental to each other, and they could be full of misinformation and kind of confusions, and that could be quite damaging for women. And another thing I want to raise is there are many mother-baby products that are pushing very hard with marketing, and that's really not ethical, because when women are at that vulnerable stage of facing problems with her own health and well-being of her babies, she could be quite easily kind of influenced to pay money on something she doesn't really need or make the wrong decisions about her feeding choices and things like that. So it's very important for us to make sure that we are responsible for them and try not to push marketing and things like that to them, to be ethical.
Okay, that's interesting. Thank you. Now, of course, this feeds back into the previous conversation we were just having, or the presentation that Adam did on professionalism as well. So I'd like to ask you, Liz, about what you look for in those that you work with. You know, what things appeal? What do you notice when you're trying to find the right sort of people to work with, whether it be founders or whatever it might be?
So it's a really good question. I mean, there's a number of different things that I could touch on here. I'm going to bring it down to what kind of people we want to work with here at Orca. We're actually going through a huge growth at the moment, and what we're looking for is a passion for the mission. And obviously that really resonates with the title of today's session. We want people to be passionate about improving lives through digital health, and that comes first and foremost. This is obviously quite an early area, and digital health, it's not been around for years and years. There isn't necessarily a huge swell of curriculum, so we're not necessarily saying we want somebody to have these certain academic professional requirements, because they don't necessarily exist. So the first thing is a passion for your mission. The second thing is get obsessed with the problem. What we see, particularly when we're talking to founders and digital health organizations, is if they're obsessed with the problem, then they will probably be more successful, because they'll really understand that problem from the end user's perspective. And that's really what you start to see. So I suppose it's passion about the mission, get obsessed with the problem, and also a commitment to quality. Commitment to quality is absolutely critical. This isn't like creating games or another sector. This is so important. It's about people's lives. So commitment to quality is absolutely critical, and it stands you in good stead.
Excellent. Now, Chen, I know you've been through a process of finding investors and co-founders and obviously employees. What sort of things were you looking for so that you got those ethical boxes ticked?
Is this a question for me?
Yeah.
Great. That's really good. So good question. So to find employees or find anyone in the team, we always try to find people who have that big heart and who are passionate of supporting mothers. So in our very small team, between 7 of us, we have 13 children, and we are all breastfeeding mothers. And we try to always find someone who are like-minded, who can fit into other mothers' shoes and understand the real emotions, the real pain, real problem they're going through. So everything we do is based, all the decisions we make are based on supporting mothers and how best to support mothers. And this also is related to how we find investors. We are not trying to find someone who just be able to give us money. We want someone who is driven by the impact, who can see themselves joining us to support mothers around the world to breastfeed and to have a better new motherhood experience. So we really try to turn ourselves away from people who ask us how soon we can exit the business, how quick we can sell the business, and things like this. We want someone to have that patient capital to join our journey in the next 5 to 10 years and to see us really achieve our impact globally. And that's our very important criteria.
Interesting. Thank you very much. Liz, where did you go when you had ethical questions that were concerning you?
So I think that one of the things that's always stood me in good stead is I know what I know, but I'm also very aware of what I don't know. And I think that you have to be really honest with yourself. I am yet to find anybody on the planet who can answer all of the questions that you may have. And so what that leads to is a need to have excellent networks, excellent organizations that you can go to who are expert in these areas. And so, for example, one of the first things that I was wanting to make sure that we had nailed was any legalities around what we were doing, making sure that we were managing any risk for healthcare professionals who would be recommending digital health technologies. I'm not a lawyer, and I'm not a lawyer in digital, and I'm not a lawyer in digital health. So I went and found somebody who had that experience, and they came on board as my co-founder. But there is such a wealth of support out there, and I think that the first thing that you need to ask yourself is, well, what is the next question? And then look to the system. Don't think, I mean, I mentor quite a few clinicians who are entrepreneurs, and I do get asked quite often, oh, should I go on a coding course? No, you shouldn't. You should find somebody who's excellent at coding, who really understands this space. So collaboration is actually king here when you've got questions, and don't think that you have to be an expert in everything. You never will be.
Interesting. Chen, you mentioned that you worked with Innovate UK with Cambridge Ventures. Were they helpful to you with these sort of ethical questions when they came up to you? Did you go to them, other places?
Yeah, I think it's a really good place to go to. And we have been supported by some other organizations like SET Squared, Business West, and Academic Health Science Network. So I find a lot of support. Like Liz mentioned, you can't be expert of everything. When we need legal support, when we have ethical questions, when we have data compliance questions, and so on, we turn to the experts in those organizations, trying to give us advice or connect us to someone else who has experience in that area, so we can deal with various issues much better. And another thing I find quite useful is to build a network of other startup founders and entrepreneurs and successful business leaders, because we can draw so much experience from them, and kind of see from their startup journey how they have faced different challenges, faced the kind of, especially some sort of ethical questions, and how they have answered them successfully. So yeah, I suggest everyone else to build a network and really surround themselves with really, really good advisors and mentors.
Lovely, thank you very much. Well, that's been a really interesting chat. I've got one more question for each of you, which is around what advice you would give to someone just starting out on this journey. So maybe there's people watching in now who are thinking, oh, yeah, I want to get into this innovation space. What advice would you give them, Liz?
So the first thing to say is now is the time. We are literally in the middle of the digital health revolution. Every day, 5 million people download one of these solutions, and we've seen an increase of 6,500% in healthcare professionals recommending these tools to their patients. It's a very exciting space to be in. It's also quite a challenging space to be in. So get ready to be tenacious, get ready for some challenges, but get obsessed with the problem that you're trying to solve, because whilst you're going through some of those challenges, it'll be the problem, solving that problem, that will get you up every day and help you to have that tenacity.
Brilliant, thank you. Chen, what would your advice be to a would-be innovator?
I actually want to talk about my advice from a different angle, mainly about entrepreneurship. I think entrepreneurship, I want to use the analogy of Chinese bamboo. So Chinese bamboo is the world's fastest growing plants, but the first 4 years is completely under the ground, and no one can see any progress or any growth. But in the 5th year, it will basically break the ground and shoot to the sky, and it broke the Guinness World Record of as the fastest growing plants. What lessons this teaches? It teaches that entrepreneurship needs patience and resilience. Sometimes nothing happens for years and years, but it doesn't mean your effort is not going to be paid off. It's like Chinese bamboo, is building a very complex root system so that it will gather the energy and it will gather the strength to grow in the 5th year. So I encourage all fellow entrepreneurs, startup founders, and business leaders to carry on, to be patient, be resilient, and eventually we'll fulfill our mission and we'll make it if we don't give up.
Thank you, Chen. That is an excellent analogy. And if you put your name and Chinese bamboo into the internet, you'll come up with an article that I wrote about you about 2 or 3 years ago.
I know.
Called it, wasn't it? Yeah, excellent analogy.
Such an honor to be written.
Thank you so much. Thank you so much for your comments. We've really enjoyed that. So it just remains for me to say, Xie ni Chen woman Han Jihuan Nida Pinglun. And thank you very much, Liz. We very much enjoyed your comments.
Thank you.
Thank you so much.